Okay, well, we've come to the last session of the day of the conference, and this is how I learned to cope with my IBS, self-help, and complementary therapies. And I'd like to introduce Sue Frisby, previously Sue Backhouse, first off. Sue co-founded, she's responsible for the day really, Sue co-founded the IBS Network with Christine Dancy 25 years ago, producing and editing Gut Reaction and setting up a network of self-help groups. She co-wrote Overcoming IBS with Christine Dancy and also collaborated on 2 further books, Treating IBS and IBS, A Complete Guide. Sue believes strongly in the power of self-help and working as an equal partner with healthcare professionals. She now lives happily by the sea in North Wales, making very special chocolate and studying music technology. Sue.
Good afternoon, everybody. It's lovely to see so many people here. It's such a validation 25 years on. What I'm going to speak about this afternoon is my very personal story of how I learnt to manage my condition and live a positive life. I'm also going to talk about my involvement in the IBS Network and its significance in my healing. And finally, I want to say what I believe would make a positive difference for the future. I've had IBS since puberty, and listening to some of the other speakers, that appears to be quite common. But I've improved significantly over the last 7 years or so. And for a lot of that time, in the early years, it was for me a daily issue. And I developed anxieties that controlled my behaviour and informed my decisions. And I felt like I couldn't be who I really was. And I often felt embarrassed, ashamed and fearful, like many of you I'm sure can relate to that. So, for example, it was difficult for me to have a meal and then go out for a walk. Lots of people love that kind of thing, but it wasn't good for me because that activity would often instigate stomach cramps, and I'd become anxious in case I needed to go to the toilet and I wouldn't be able to. And then another time I might develop the anxiety first in case I had the stomach cramps. So this, vicious cycle comes into play. And I didn't feel confident about explaining this to people. And so if I could, I would avoid certain situations. And in a similar way, I found myself avoiding getting close to certain people because they might want to do something I was fearful about. And I didn't have the ability at that point to explain something that to me was so personal and intimate. So it's not a problem, in my view, to say I don't want to go up the Eiffel Tower because I'm afraid of heights. But for me to say I don't want to walk through town after we've had a lovely meal out because I'm worried if there's going to be the toilets if I need one, a lot of shame came in. And some of this is connected to me being over-concerned what other people think and being afraid of people's judgments. But I really didn't like this part of me, and my self-esteem really suffered. So by the early 1990s, I'd lived with this condition for about 15 years or more. And I just had a light bulb moment, I think. And I thought I could see, I knew there weren't any self-help groups and there was no internet then. So I presume looking back, I must have searched in the library. But there weren't any worldwide, I don't think. And it was a culture at the time where self-help groups were just becoming for different medical conditions, but it was still quite rare. There was one for people with colitis, and I remember that. So anyway, I advertised in a very specialist newsletter for voluntary groups, just to see if anybody would be interested in starting up one. And I got one reply, and that's just one reply. Anyway, that was from somebody who would become my friend and a very significant person in the story of the IBS Network. That was Christine Dancy. She was based in London and she was really keen, and I was based here in Sheffield. And so we decided to set up a self-help group with a base in both places. And for a little while we trundled along, and we produced a copy of our newsletter, which then went on to become Gut Reaction. And we might have had a membership maybe of a few tens, at that point. And then we got a tiny mention, a paragraph in the Sunday Mirror and the Good Housekeeping magazine around the same time. And I think a little mention on the radio, and the floodgates opened. From receiving maybe 10 inquiries a week, we received 10,000. Almost. It feels like overnight. It might be over a few weeks. And some came to me in Sheffield and some came to Christine in London. And I remember a friend would collect carrier bags full because we had a PO box number, and she'd bring them to my house. I'd open them all. And this was crazy for me because I just had a baby. And Christine and I quite quickly went on to write a book together because there was so little information. This really was the dark ages. Even the term irritable bowel syndrome was a relatively rare thing. And our book, Overcoming IBS, was one of the first in the world written for people with IBS. But more importantly, it was the first to be published that was actually from the point of view of the people who have it. So, in terms of the IBS Network, the group that we then named the IBS Network, we went on from strength to strength, and we received priceless help from Nick and his staff at the Northern General. He gave us an office in the GI department, no charge, medical expertise whenever we needed it, and always a really friendly, encouraging environment. And that was really significant because we were just, I was just an ordinary woman. I had no medical professional background. I just had my own experience. But Nick and his staff validated us and trusted that we were onto something important. So eventually it wasn't a couple of volunteers here in Sheffield and London, and I feel really proud to be part of that story. And from a personal point of view, it was a major factor in my healing. And I'll tell you why. We're only as sick as our secrets. I've heard that said, and that's true for me. I found in this involvement that I brought my fearful, shameful secret out into the open, and I began to tell people about this part of me. And the consequences were all positive. I realised very quickly I wasn't alone, and I had thought I was, not literally alone, but very, pretty isolated. And I realised that I could make a positive difference in people's lives, and that's, acknowledged as being a real important sense to your well-being. Many, many people wrote to us, and they described the relief that they felt, that they realised they weren't alone, and they had done at the time, and to know that there were others that understood, like nobody else, can, unless you live with this condition. So I felt really proud, and that increased my personal self-confidence. And I also experienced respect from other people in connection with something that I previously felt ashamed about. So that was a real positive turnaround. And it enabled me to have a lot more self-acceptance. So in terms of what made a positive difference to me, I'll briefly mention what didn't. I didn't go down the medical route really, because when I was 15, I did go to the GP and I was prescribed Valium and a bit later codeine, and even at that young age I was very wary. I knew that both of them could be addictive, and I didn't want to go down that path. I do believe that some medications and some complementary remedies and practices can help for people, but they didn't for me, or I didn't find the right one. But I did a lot of investigations into food. And, like Nick was saying earlier, I tried so many different things, elimination diets, cutting out all sorts. But the IBS is such a mystery, my IBS is such a mystery, because there was nothing conclusive. So I might say, yeah, I think no gluten's good, or sometimes dairy-free helps, but it just wasn't conclusive. But what has really helped me personally is a change in my thinking, and this is a significant part of what I want to say. And these are some examples. So through my investigations into health and well-being, I became more in touch with my body again, because I developed a kind of separate feeling. I'd lost trust in my body. I felt like it was going to let me down. I also learned, for me, that it's important to say no. And it might be whether I can't manage to go for a walk or to a meal that I know would be challenging for me, or simply because saying no is sometimes really good self-care. I learnt more self-acceptance, and I learned that personally that I benefit from being more open with people, expressing what I need and what causes me anxiety. Then I begin to feel that I'm in a safe place. I learnt to take control when I can. I made lifestyle choices. I moved to the countryside, and I do what I love doing now. And I also learnt to take good emotional self-care when I need to. For me, a good saying is sufficient care, sufficient risk. That's how I get the balance. And this is flashing now, but I want to say finally what would for me make a major difference in the world that we live in, and it's around toilets. We've touched on it a little bit, and I know there's a campaign going on, but I would like to see a complete cultural shift around attitudes toward the provision for public toilets. I want to be able to go out and explore the world and be spontaneous without thinking, you can make plans, but not always planning around the toilets. And I live in a very pretty seaside village, and we get hundreds and hundreds of people in the summer. And even then, the public toilets close at 5. So what kind of message we're being given? I want to see public toilets available all over, open 24 hours, well-maintained and welcoming, so we don't feel like we've got a curfew going on or housebound. And it's not just us. I mean, we are important, but that would also benefit, obviously elderly people, pregnant people, children, and a big portion of the population. Thank you.
Yeah. Next up, we have this morning's co-chair. We have Angie Usher coming up. Prior to being diagnosed with multiple long-term conditions, Angie was in fashion. She managed a chain of stores producing her own clothing line, which dressed the likes of Take That and the Spice Girls. She learnt to manage her fibromyalgia and IBS from her time on Expert Patients Programme. She is now a tutor, assessor and ambassador for Self-Management UK. Thank you. Thank you. So, do I do next? No?
Do you want to do the questions?
Am I? Okay, I'll start anyway. So, thank you very much. If you're not already bored with me, you will be in a minute. Just a short bit about me. In that very nice introduction, I used to have a completely different life. I worked in fashion, as I say, and mixed with a lot of different different types of people. I used to do the door of nightclubs and things like that. I was kind of not really an it girl in London, but I was kind of close to it. So life was very very different, and then I developed my long-term conditions, and doing the door of nightclub doesn't go very well with having to find the toilet all the time and things like that. It's quite hard to actually talk about this because I've had diagnoses of quite a few different long-term conditions through my life. It seems I've always had something wrong with him. My earliest memory is going to the doctor with problems with my eyes, and then it went to my feet, and everything I've had wrong with me. Trust me, we'd be here till Christmas if I told you everything that I'd had to go through. And I was saying at lunch, I kind of have always, since my diagnosis of fibromyalgia, I have always put that on any forms, anything that says, have you got any long-term conditions? I always put fibromyalgia as my main long-term condition, purely because I know now that is recognised as a long-term health condition. When I was first diagnosed with it, it wasn't. And so I've been through this whole thing twice now, so I have to explain fibromyalgia and what it is and how it affects me and everything, for doctor to say, well, of course, it's really in your mind, and things like that, which is like a red rag to a bull. and now with the IBS as well. So I always put fibromyalgia as my main condition. Having listened to everybody today, I've kind of changed my mind on that, and I think I am actually going to start putting down IBS as my main condition, because I am recognising so much of what other people have been talking about with their symptoms, their experiences in my own life. I went to my GP with basically these symptoms. I just looked these up on Google and on Google Images. This is what it came out with, and this was me in a nutshell when I went to my GP. The word embarrassment's been used a few times today. I was totally embarrassed. I left it an awfully long time before I went and got this diagnosis. I went through all the usual tests and the people have been talking about endoscopies and thisoscopies and thatoscopies, and I'm not a medical person, obviously. And at the end of it all, my doctor was very nice, and she actually said to me, "I'm afraid you have something called irritable bowel syndrome. It's treatable, but you're going to have to make some major lifestyle changes. Diet will play a big part in treating this, and then the last bit, but I'll give you some medication anyway." So, of course, me being me, at the age I was then, I thought, oh, well, I won't bother with the diet, I'll just take the medication, because that's fine with everything. Painkiller stops pain. This is IBS medication is going to stop the IBS. How wrong I was, because it was just taking more tablets and more medicines and things. And it wasn't until I started changing my diet that I realised, the importance of diet in IBS. I'm obviously not a saint. Look at me, I'm hardly twiggy. I always put that down to, I take so many different types of medication, and a lot of antidepressants, they put weight on, this puts weight on, that puts weight on. Also, eating like a pig puts weight on. It's just like, there's no, it really isn't, just rocket science. But I've trained my eating habits better now. I'm going back to the early diagnosis. I did get I'm happy to say that it's nothing sinister going on down there. I'm pleased to say it's not cancer. And obviously I'm very pleased to know it's not cancer. I'm very pleased to know that it's not anything sinister going on. But it's a difficult thing, as we've heard. It's a difficult thing to manage. It's a difficult thing to just cope with in day-to-day life. How do I manage? A lot of this has been covered today. I eat a healthy diet as much as possible. I avoid spicy foods. I exercise, which before my diagnosis was an actual foreign-sounding word to me. What's exercise? Comfortable clothing is the key, because I've spoken to various people today who have said that, you manage to kind of like put on about 4 dress sizes in a day. So that's really, really key. Keep hydrated. I know, Nick, you said you drink phenomenal amounts of water. I aspire to be like you, but I do drink a lot of water now. I avoid my particular trigger foods. I eat regular small amounts rather than a huge breakfast, a huge lunch and a huge dinner. I tend to just, breakfast I really don't like. That goes back to my old clubbing days, because I didn't get up before lunch. So breakfast is quite a new thing to me. And so I just have a light breakfast, but then I'll graze through the morning on healthy snacks. Rest. Chronic fatigue has been mentioned a lot today. Rest is so important for me, because it's also part of my treatment for fibromyalgia is rest. And I also have chronic fatigue syndrome, so I have to rest anyway. Carrying spare underwear, we've spoken about that. Prepare in advance. It's like going on a Himalayan trek or something. If I'm going somewhere where I don't know, I'll always go and do a recce first to find out where the toilets are, how long it's going to take me to get here, there and everywhere else. Public transport, because I don't drive. I live in London. I've never found the need to drive, and it's too expensive anyway. But I appreciate everybody has different strategies. At this point, I would just like to say, a lot of people I've heard saying they suffer with their IBS, they're sufferers. if that's what you want to say, that's absolutely fine. I found the first rule in self-management for me was to give up the word suffer and just say I live with, because all of a sudden I was not being a victim to my IBS. I was living with it, and it was another part of me like everything else. My next thing, very quickly, is jacket potatoes are now my best friends. Because, usually there's a jacket potato on a menu. You don't have to have the beans and the cheese and the fart machine beans and all that kind of stuff. You just need a plain jacket potato, for me, is my best friend, because a jacket spud will never let you down. Just to throw a bit of humour on it, you're in good and bad company if you have IBS, according to Google. So President Kennedy has had IBS. Tyra Banks, a supermodel, has IBS. Sybil Shepherd, an actress who I very much admire. Linda Carter, apart from being an actress, she is Wonder Woman. She has IBS. Kurt Cobain, any of those who, Nirvana, no. I never knew he had IBS, so that's something I learnt. And Adolf Hitler, we'll just skip over him, but it just goes to show that good and bad people have IBS. And lastly, you talked about expert patients programs, you mentioned a few times. That's where I started my self-management journey. We then became expert patients program community interest company, which was such a long mouthful. So when we got out of the clutches of the Department of Health, their first 10 years of funding us, we just became Self-Management UK, because it does what it says on the tin. It helps us self-manage our conditions. I definitely wouldn't be here today if I hadn't found self-management. I probably would have topped myself, and it probably would have been because of the IBS, because the other things I've been able to manage better. IBS has always been the most difficult thing for me to manage. I'm running out of time. Just to say that in my professional career, with people delivering courses to people who have long-term conditions, IBS is quite often a secondary condition to their main condition, and self-management can really help in the management. It doesn't take it away, it doesn't cure. We've established there isn't a cure, like there isn't for any long-term health condition, but self-management is something that I would really recommend people, whether it's through Self-Management UK, who I work for. A lot of places still have the expert patients program. They didn't move from, because different CCGs run self-management differently. There are other providers, but I would definitely say look into self-management, because it took a great weight off of my shoulders, knowing that I had some control over my IBS. Which, as I said, is probably the most difficult thing amongst all of my many conditions to manage. So my time is out. I have leaflets for Self-Management UK if anybody's interested. Thank you very much for listening to me waffle. You've been a great audience. Thank you.
Well, thank you, Angie. And now we come to the last presentation of the day, and it's going to be on complementary therapies. We talked about self-help, how to help yourself, how people have got over their IBS. What is the role of complementary therapies? And I'd like to introduce Linda Booth. And Linda has been a natural health practitioner for over 24 years and now runs one of the most successful natural digestive health and gut disorders clinic. She promotes modern naturopathic colonic hydrotherapy as a treatment for IBS and has developed the UK's first dedicated digestive health supplement range just for tummies. So tell us about the role of complementary therapies, Linda.
Thank you, Nick. Hello, everyone. I'd just like to thank the previous speakers for speaking so eloquently and personally about their experiences of their IBS and being so brave to tell so many people their personal stories. Thank you. So yes, my name's Linda Booth, and I've been in private practice for just over 24 years now, and I specialise in functional, digestive and gut disorders. I treat a lot of people that present with IBS or the symptoms of IBS. And I've carried out many thousands of colonic hydrotherapy treatments on people with IBS. So, alas, by the time a person approaches a complementary therapist for help with their IBS and their IBS symptoms, they've had the condition for many, many years, in some cases decades. And as such, the condition is what we would term as chronic, deep-seated. So you'd think, therefore, that little can be done by a complementary therapist to improve the symptoms. After all, by the time they've accessed a complementary therapist, they've had access to all that the NHS has had to offer. Medication, consultants, scans, x-rays, and procedures like endoscopies. However, this is not the case. Complementary therapists can and do provide a holistic and holistic approach to getting to the root cause of what is causing the symptoms and put together a protocol to treat them. Can I have some water, please, Sam? My glass is just down there on the floor. As a colon hydrotherapist, I often hear, "I've tried everything and nothing has helped. You are my last hope." Thank you. And I believe them. Because having colon hydrotherapy treatment would be the very last thing on a person's top 10 list of complementary therapists to have. And that's because there are so many myths, misconceptions, misunderstandings, lack of education and awareness about the benefits of modern naturopathic colon hydrotherapy and how it can treat many functional gut disorders. Most people with IBS, when they approach a complementary therapist, are fed up, at the end of their tether, ashamed, embarrassed, frightened, depressed, and with the symptoms having a debilitating effect on their health and well-being and quality of life. We know that IBS isn't life-threatening, but it can certainly be life-limiting in the effect it has on a person's health, well-being, work, social, and family life. Complementary therapists are usually approached through recommendation or after doing a Google search and having read testimonials and reviews on therapists' websites. Complementary therapists are able to offer time, and this is a luxury that the NHS simply does not have. Because we have time, we can give our clients our full and focused attention, coaxing out of them things that may be happening in their lives that are contributing to their IBS symptoms, encouraging them to look outwards instead of inwards, giving them an understanding as to what may be causing their symptoms and building their confidence. We keep in touch with them, or at least I keep in touch with my clients via phone calls, emails, and social media to offer extra support. Complementary therapists are not run ragged trying to hit NHS targets and are not confined to the NICE guidelines. So we have more freedom to tailor our treatment protocols. We as practitioners are able to choose from a vast array of tools we have at our disposal in order to best serve our clients' interests, which makes our job a creative art and with a little alchemy thrown in. We take a comprehensive health history, undertake visual and manual examinations, and more importantly, we listen, as very often the reason they have IBS can become apparent in conversation. I'm very much a hands-on therapist, and I like to get my client on the treatment couch and have a good feel of the abdomen, including stomach, liver, intestines. I can determine a good deal by palpation, as the coils of the intestines, when healthy, should be soft and malleable, and in people with IBS, they most certainly are not. They are hard like concrete due to irritation, inflammation, excess gas build-up, bloating and spasm. Of course, the treatment I carry out also gives me further insights into the state of a person's gut, quality, consistency and shape of stool, any undigested food because of not chewing our food properly, excessive fermentation and putrefaction. I find that people with IBS want answers. They want to know what has caused their IBS and what can be done to cure it. I also want answers to a couple of questions that I ask every IBS client. What do you feel has caused your IBS symptoms? There must have been a time in your life when you didn't have IBS. What event, illness or tragedy, stressful event or accident precipitated your symptoms? And what do you feel you need to change to improve your health? After a good long chat and a colonic treatment, I can then put together a customised treatment protocol. And this may mean referral to other therapists, for example, a hypnotherapist, or even referral back to their GP. Dietary and lifestyle guidance and supplements to help reduce their symptoms, and in many cases, completely eradicate them. And I'd like to say, and it's good to hear from a doctor, Marion, who actually recommends probiotics after antibiotic therapy. Very important. Every IBS person that comes to me are recommended probiotics. I explain to them that they are as much responsible for the successful outcome of the protocol as I am in providing it. It is very important that they understand their responsibility in enabling a good and positive outcome. There is a huge body of anecdotal evidence supporting complementary therapies and the successful treatment of IBS, but there is no one size fits all. Whatever discipline the practitioner practices, it is vital that the person with IBS and the practitioner click and gel together. It is very much a two-way relationship of mutual trust, respect, and understanding. And that's it. I stuck to the brief. Thank you.
I think if you stay there, Linda. Angie and Sue, you'll have to share a podium.
Yes, Jill Kemp. I run Public Toilets UK and Truckers Toilets UK, so I was delighted to hear that Sue particularly mentioned the problems of getting public toilets. As you're all aware, a lot of them are closing around the country, in Sheffield as well. That hasn't been passed by. So what I would ask all is more a comment than a question, that if you have trouble accessing a toilet, don't just sit there or walk away and worry about it, do something about it. Write to the council, come on our Facebook page. If you contact me, I can give you a card, and let's do something about it, because all of us with IBS need the loo. I don't know, like many of you, I have to plan my journeys or stay at home. And if you stay at home, you're inviting other health issues as well as your IBS.
Thank you. Is that it? Are we all done?
I think that's a really valid point. I would encourage people to do that, because staying home, as you say, brings other things like depression, anxiety because you can't go out, etc., etc. So please, let's do something about it.
Hi, just to Linda really, I'm a colonic hydrotherapist as well, but I've also been a nurse for 32 years. So I've worked in acute surgery and seen that most people that came onto our assessment ward had abdominal pain, and they would have abdominal pain for many reasons. But the reason I looked at that group was they all had abdominal x-rays when they came in. And it was very easy to see that a lot of those people, probably about 80% plus, were loaded with faeces, and they had that there in their everyday life, and there was nothing wrong with their bowels because they went to the toilet every day. So applying that knowledge to my nursing knowledge and my colonic hydrotherapy learnings sort of added up that there was an awful lot of poo lurking around that shouldn't be there. So started to practice, and as quite a sceptical nurse really, I'm still amazed 9 years down the line that IBS symptoms can radically go very quickly with colonic hydrotherapy. And it's practiced, and my colleagues, we are registered, we are highly trained. It's not somebody at the back of a beauty salon who's had a week's course. So it's something that possibly IBS Network should be looking at, and if anybody wants any more advice, they can go through Archer and RICTAT, that are the professional bodies that I've been involved with. And I just feel really sad that you guys who are sufferers have suffered for such a long time when many of my clients don't suffer anymore. So just wanted to put that out there. So go find out about it. Okay.
Thank you. I'd just like to say as well, I wanted to ask a question earlier when the previous gastroenterologist was speaking. What was his name, Nick, the young guy?
Oh, no, Alex.
Alex. He mentioned about breathlessness and back pain. And I tend to find that there's a direct correlation between one of the major symptoms of IBS, and that's bloating, abdominal bloating and distension, and breathlessness, and back pain, and bladder urgency, and some gynae pain as well. Because, you know, the organs in the abdominal cavity are competing for space. Everything is crammed in there, and more so in a female with ovaries and uterus. So once those intestines begin to expand and distend, they're going to push up into the diaphragm, into the chest cavity. They're going to, you know, squash the lungs. They're going to push down onto your bladder. They're going to put pressure on the lumbosacroiliac joint, the discs and the nerves there, and cause back pain. And time again, I've had clients where they've had colon hydrotherapy and those symptoms have disappeared. It's anatomy. It's hydraulics.
I'd just like to say something in connection with this, and probably about our attitude towards colonic hydrotherapy as the IBS Network. Now, I personally believe that colonic hydrotherapy has a place, and I was so interested in it that I actually went on a colonic hydrotherapy course, or spoke at a colonic hydrotherapy course, and had colonic hydrotherapy, as you know, Linda, which wasn't bad. I went for a run immediately afterwards and got a headache, but apart from that, it wasn't too bad. But the only thing I feel about it is this, that I think it can be very, very useful for people, particularly people who are constipated. I think it can be very useful. I worry about diagnosis of inflammatory disease, and I think it's very important that inflammatory disease is ruled out, particularly diverticular disease, colitis, Crohn's disease, and things like that. So one would want that to be effectively ruled out. So before going to a colonic hydrotherapist, I would want somebody to see a doctor and have those conditions excluded. The other thing I worry about, and I don't think it does colonic hydrotherapy a lot of favours, and that is the fact that because you've got to make a living, it's often seen as a lifestyle thing. It's part of a detox thing. Now, I think that potentially is a little bit, potentially a little bit dangerous. And I would like to see you brought into the NHS as performing a service rather than having to offer a detox service to the general public. And that's my personal view.
Yes, thank you. Well, it's seen as a celebrity type treatment, isn't it? And people don't appreciate the wider benefits of modern naturopathic colon hydrotherapy.
You got any more questions?
Yeah, there's a couple.
Yeah.
Thank you for your eloquent talks. I am interested to hear about colonic hydrotherapy as a gastroenterologist, because we quite often find that people's symptoms improve after colonoscopy. And I wonder if you, and I often think that's because we've cleared the bowels out.
It's the prep, yes.
And I wonder if you have any thoughts or comments about that.
Well, yes, it's the prep, isn't it? So they're getting, they're having a good clear out. The bowels it's a bit like a colon hydrotherapy treatment from the top down.
Yeah,
yes.
that's exactly how I feel.
But of course the PrEP, I had a phone call from a lady yesterday inquiring about colon hydrotherapy because she can't take the PrEP because a lot of them have aspartame in, and she's allergic to aspartame. So she was inquiring about having colon hydrotherapy treatment prior to having her colonoscopy. And I said, well, that's something that you need to check with your gastroenterologist. I said, I'll be happy to do it for you, but I need, you know, the approval of your gastroenterologist first.
There's a question, yeah, is the mic on? Hi, thanks to all three of you for your talks. I have a question for Angie. I really appreciated your distinction between IBS sufferers and people living with IBS, and what you spoke about trying to accept IBS as being part of you and not an external or just a biological thing that would let you down. I wondered if you could tell us a bit more about what it was that helped you to change the way that you thought to be more accepting of it.
I think the knowledge, the realisation that it was going to be the most difficult one of my conditions to manage. And I did also, I think also because it wasn't, it was the thing that was the most embarrassing to talk about. You know, a lot of people have back pain, a lot of people have muscle joint pain, etc. Migraines, so many people have depression. But there is a stigma. You know, I think mental health's got less stigma now because I work in mental health as well. And I actually think that, you know, it's incredible that politicians will stand up and talk, quite rightly, for mental health to be destigmatised, but we still can't talk about, like, you know, I need to go to the toilet to our best friends. You know, to me, there's something totally wrong with that. But so I think it really was that. It was finding, it was knowing that it was the most difficult one, and it kind of stood aside from all my other conditions. And I was as guilty as everybody else. I used to say that I suffered from it if I did speak to anybody about it, because I really did feel that I was suffering. I mean, for me now, it's a word that's bandied about quite a lot, suffering, but you believe, you know, anybody in this room will tell you when you're in the middle of an exacerbation with your IBS, you are suffering. But that suffering, for me, that suffering ends. So, you know, I now then just accepted, okay, I'm living with this now. I'm living with this the same way as I live with, you know, 2 arms, 2 legs, luckily. You know, it's just something that is part of my makeup. It's something I've got to accept. It's not going to go away. So I've got to manage it the best possible way that I can. And by doing that is, instead of setting out on a limb somewhere and pretending it wasn't there, and ignoring all the things that I was told would be good for me to manage it, because I did do that for a long time, because I didn't kind of want to give in to it. I wanted to be the same as everybody else. I was much younger then, obviously. But it was the whole thing about, you know, eating differently to everybody else, the whole thing that we've discussed about access to toilets, and when you're in clubs and things like that, or getting an exacerbation while you're out and then think, oh, I've got to go now. You know, oh, what's wrong? Oh, gosh, she's off again, she's ill again, that kind of thing. And I had to very quickly wake up. That was either going to completely control my life, or I was going to say, right, okay, this is a part of me, it's a part of me that I'm not going to be able to give up, so I've got to live with it. If that answers your question, it probably does.
Thank you. Okay, thank you very much, ladies.
Thank you.
Thank you.